Hey everyone, welcome to the Dr. Jason West and the West Clinic team live cast every Thursday night at 5 o'clock. This is going to be our best live cast. I'm so excited to tell with you science about light therapy and how it's so amazing for energy, for immune system. We post a little picture of me getting a new treatment in the office, and I have a special guest, one of my very favorite people on the planet. Misty's going to come and work with us. She's been with me for 13, 14, maybe 15 years, and I'm excited that she's going to be here. She promised that she would come on as long as I didn't have to ask her any questions, so she's not going to talk. We're just using her as a demo, but she's important to me, so that's exciting for you to see. So everyone, if you're just joining us, it's the Thursday night program, and we have a really cool link in the comments where you can get a bunch of information about light therapy, all the science and everything that we're talking about. Just click on the link and it'll take you over there. It asks you for a little bit of information, and then immediately you're going to have all of the PDF information about what we're sharing tonight. It's light therapy. So Thursday night, Dr. West live, and what a show we have for you. And what's really fun about this is there's proof in the pudding. And what do I mean by that? I mean there's actually people that are really getting great results with the light therapy. I'm going to share those with you. And so, Caden, if you can bring up either Noble or Brandon, and I'm excited for you guys to see this because both of them were, when they came in the office, they were cautiously skeptic. And what that means is, normally when we see people in the West Clinic system, they've tried a whole bunch of different people. And I think I was Dr. 13 or 14 or something like that for Noble. And he came in and he's like, look, I want to believe what you're telling me. I just don't want to get my hopes dashed. And we started working with him. He wasn't even able to work when we started. And here's the story. So check it out. Hey everyone, it's Dr. West and Noble at the West Clinic, and we're just excited to give some people some hope and some optimism because of Noble's story. And so I asked him if he would be willing to share it, and he's like, yes, I will do that. So Noble, tell everyone what you felt like before you came to the office.
Well, I was very fatigued every single day. I had a very hard time getting the day-to-day tasks done. I had to sleep a lot to just be able to stay on top and get the work done I need to in the day. And just tons of fatigue. Yeah,
so did you have a medical workup or someone trying to help you before you came here?
I did, yeah. I had a few doctors try to help me. We went to sleep doctor, general doctors. We tried different medications or different techniques. We tried natural doctors. And
was there a original diagnosis when you came in? Was anybody saying, hey, you have Epstein-Barr, you have chronic fatigue, you have myalgic encephalopathy? Do you remember what they said?
They didn't really say much. They had some speculations, but nobody came up with a definite answer on what the problem was.
And you live a couple hours away. You decided to come to the booming megatropolis of Pocatello, Idaho. And we did our workup, and we started giving you treatments, and what happened?
Well, I started the first little while, didn't really feel much a difference. And then after about 5 weeks, halfway into it, I started feeling a difference and changing and taking the supplements that Dr. West gave me here, and started feeling a lot different. I could get my work done I needed to in the day and just have a full and good day every single day. I really appreciated you go to a lot of doctors, alternative type doctors, and it's kind of wishy-washy. You don't know what you're gonna get. But here I felt like it was very scientific, it was very proven. You look under the microscope, you see your blood at first, and then you do it again after the treatments and you see your blood again, and it's just a night and day difference, and you can see the change, you can feel the change, and you know exactly what made the difference after you come here.
Yeah, and I appreciate you, Noble, sticking with me, because the first couple of weeks you're like, hey, I don't think I'm going anywhere, and I'm like, you just got to give the system a chance. We dialed in, the supplements. One neat thing that you told me that I was excited to share with people is you're like, hey, I don't have to take a 3-hour nap, during the day. And you've changed jobs. You have enough energy to do a little bit different job.
Mm-hmm.
And the treatments we gave him were the vitamin infusion treatments, specific nutritional therapy, and then the nerve reprogramming. So Noble, tell everybody a little bit about your experience with the neural therapy.
The neural therapy, well, it was a lot of needles, that's for sure, but it's really not that bad. After a while, you just kind of get used to getting poked.
So the neural therapy, what we wanted to do is help Noble's nervous system to be here, because what he's used to was living down here. And so we do that nerve reset, and initially people are like, man, I don't want to really do that. And what's neat about this story is that I know the system will work if you keep putting good things in people and get their nerves to restart. And Noble gave us the opportunity to do that. He stuck with it. He did a bunch of lifestyle things. He eats clean. He got the supplements. And now what's exciting is, like, this is kind of our last visit for a while, because I said you don't really need us anymore, which is really encouraging, because that's the goal of the office, is to help people to prepare themselves. He followed through the program. New job. Fatigue's gone. Noble, is it okay to share the story with other people, give them a little bit of hope?
Yes,
and,
of course.
And that usually means we put it on our Facebook or our YouTube channel. Is that okay?
Yeah, that's great.
And if people are watching this that are having fatigue, would you recommend coming to the office?
Yes, 100%.
So Noble did a lot of work with doctors, wasn't getting where he's supposed to. We gave him the right things that he needed with vitamin infusion and neural therapy, and now we have someone that really doesn't need us anymore. We said, well, let's do a follow-up with you in sometime in 2021. But it was really fun to take someone without a gas, and really, he wasn't mean or belligerent. He just was really skeptic when we started, and it's nice to have someone that's got their life back. Okay, you guys, Dr. J and Noble signing out, and we'll see you guys on the next life-changing video. Okay, everyone, so one of the things that we did for Noble, and it's not just me saying it, there's over 300 testimonials on our blog of helping people that were out of hope and out of time and out of options. And one of the things that we did with Noble, and we're going to show you another amazing story here in a minute from Brandon, is using the light therapy. And why I have this picture up is because light therapy in medicine isn't anything new. I mean, this is a jaundiced baby that they're exposing to light to help with the heme breakdown. This goes back to Dr. Niels Finson, the father of modern phototherapy, and he was treating lupus vulgaris with red light therapy. And back in 1903, he won a Nobel Peace Prize. And there's no question about this is a blue light therapy for the bilirubin. So I think I actually had it backwards. The baby that we showed at first, it was the red light. This is the blue light. And what happens is we know that light has effect, clinically proven to boost mood. Now, what I'm excited to share with you about is this chair right here is for my guest, Misty. So Misty, come right over. And she promised, she said she would do it as long as I didn't make her talk. So I'm not going to make her talk. But Misty's all, logoed up, represent. Misty, why don't you slide my way just a little bit? So we'll make sure, okay, awesome. And so I'm not going to make Misty talk, but I do have my phone in the studio so you can see the machines over here. And so if we want to bring those up, so there they are. These are the photonics machines, which, by the way, this is our video studio set. This is Caden, this is my son, and this is my friend Becky over here helping out. Jose's in the other room, but this is what our studio is looking like. This is the photonics therapy. Now what happens is we have these little probes right here and what's so fun about this, you guys, is this, that we don't have to stick in a system into your vein on this one. The other treatments that we do, the ultraviolet therapy we were doing before, we had to use a little bit bigger catheter. This is a non-invasive, non-painful way to help people, and there are our units. So Misty, if you'll get this set up, and so we're going to use this in just a second. Why don't we go back to the perfect. And so Misty's over here getting the machines together. This is really neat, is how you can use a sublingual applicator and SLA to basically put light into your circulatory system without any pain. That's the fun thing. No injections, no IV stuff. This is totally painless. And again, going back to the research, clinically proven methods to boost mood and energy. So we have these little boxes that you can get, and of course the FDA says it's not approved light boxes for SAD, which is seasonal affective mood disorders, and yet it's such a popular thing to get. And so the red light therapy, that's one of the wavelengths, we know it's good for hair to be healthy, wound healing, joint pain, skin rejuvenation. Here's a patient. And by the way, a special shout out to Micah and Tom Lowe, the Ozonauts. And here we go. So Caden, if we can talk about the lights, why don't we just turn those on so we can see what she's doing here. So you're hitting start, and you can see we have magenta light and we have red light. So everybody don't look right into it, but you have to see it a little bit, and you can see the lights. So what Misty's going to do here is she's going to put these on, and here's the painless way to put them underneath her tongue. And there you go, right like that. Misty's so nice to donate her body to science to help us. And so now we have, you can see the applicators over here, and we can see Misty right here, and no pain. And we're just going to take all of the light therapy. Caden, why don't you put us back up to the slide? And we're going to go through the science behind it as Misty is gracious enough to get a treatment. And I was excited to have her do this because, one, she's really important to me, and two, here's all of the silence. So Dr. Whalen, a professor of pediatric neuro-oncology at the Medical College of Wisconsin, says the near-infrared light emitted by these LEDs is perfect for increasing energy inside the cells. So whether you're on Earth in a hospital, working on a submarine, the skin and the muscles grown in the cultures exposed to LED light is 150 to 200% faster. We know that light has physiologic effects. It reduces pain, it helps inflammation, it stimulates healing. And the blue light therapy, and Caden, why don't you take us back to here? So I want to show basically what's going on so on this machine right here, you have the red light therapy, the 810 wavelength, 630, 660, and then on the other side we have the blue light therapy, the red light, and the green light therapy, all different wavelengths. And again, all that Misty's having to do is just hold the sublingual applicator underneath the tongue. And so you have the sublingual artery and the sublingual vein there, and we know that it has some amazing physiologic effects. This replaces the UVRX therapy we were using before. This is me from 3 years ago using a light that goes directly into the vein. And as you can see, this therapy, you have to use a catheter. This therapy, you just have to hold it underneath the tongue. And so the concepts behind this is we have the UV light and the blood therapy. There's medical studies. It has an amazing effect on blood, the immune system, and the wavelength of light is helpful for bacteria and viruses. So again, instead of having to use an intravenous method, now we just have to use a light method. And so fun to do. There's way more evidence, just interest growing on this. There's 3,000 doctors hitting the different types of light therapy. And we're going to talk about the ultraviolet therapy in the office. We're going to talk about the red bed therapy. And we're also going to talk about the therapies associated with the sublingual application. And if you look at the electromagnetic spectrum here, you have X-ray light, we have X-ray energy, ultraviolet light, visible light, and infrared therapy. And we're just tapping into this side of the spectrum right over here and some of the blue light therapy. One of my friends, he wrote this paper a long time ago and then shared it with me. Dr. Rowan wrote a paper about the ultraviolet blood irradiation therapy. This is specifically addressing what goes into the vein. And you can pull blood out, you can mix it with, we use some oxidative medicine, then we insert it back, and that's why we have hundreds and hundreds of video testimonials of people that have autoimmune disorders, of people that are suffering from Lyme disease, chronic infections, and energy, fibromyalgia, chronic fatigue syndrome. We're using light to get that into their system. So this is the ultraviolet blood irradiation therapy at the office. Whoops, I'm hitting the wrong button. And what we do is we get an IV going, we pull blood out, we mix it with some oxygen, we shake it up, it goes from kind of a purple to a bright red. and then it goes through a tube, and this is an ultraviolet chamber, and we attach a photon of energy to the red blood cells as they go through. And what's fascinating about this is so many times people will say, hey, is this FDA approved? Well, the FDA says it's okay to use blood and light for T-cell lymphomas. It's also approved to use the machine for modifications in your office. And so again, we're just pushing this therapy through an ultraviolet procedure. Now, what was so exciting about the new treatment that we have is we have available to do ultraviolet therapy in the blood, but we also have the ability to put it underneath your tongue, sublingual artery application. So people that have tiny veins, that are struggling with veins, and also for people that can't handle needles, which is tough because there's so many therapies you can do with IVs and injections, but when people don't like needles, I wish we had a way to help them, and now we do. And so this is a completely painless therapy that Misty has so graciously decided to demo. The other thing is the statements from the FDA. The ultraviolet blood irradiation therapy is approved for T-cell lymphoma, also involving the skin, but it's showing off-label uses for multiple sclerosis, rheumatoid arthritis, lupus, rejection of transplanted organs. We see a lot of benefit in using this for immune system dysfunction. I've seen some good outcomes with chronic mononucleosis, Epstein-Barr. One of this study that came out here, extracorporeal photochemotherapy, ECP, is a medical procedure in the treatment of different T-cell mediated diseases. Now, why is that important? Because the white blood cells that come out of your body, out of your bone marrow, has to go and be differentiated inside the thymus gland. So it's a little gland right behind the knot in my tie, just underneath the substernal notch, and the cells have to go through there for T helper cells and T suppression cells. So important for bacteria, for viruses and stuff inside of the cells, and also for immune system regulation. So what are some of the effects of the ultraviolet light? Well, it's germicidal. It has rheologic effects. That means if your blood's really sticky, it helps to get it to spread out. It's immune boosting. It helps the autoimmune's positive responses, and it has some oxygenation effects. And so we've seen inside the office, and again, these statements are from our personal experience in working with thousands of patients, is that it helps with bacteria. We've seen it help really help like things like shingles and different viruses, fungus, yeast, and it seems to inactivate pathogen in the bloods, causing the immune response. And so the ultraviolet exposure, which is the lethal exposure and the non-lethal exposure, there's some studies that suggest that it helps with the different types of immune system. See, when your immune system doesn't work right, then you don't work right. And so whether it's bacteria, whether it's parasites, whether it's certain types of viruses, it seems to be really helpful. And the results are absolutely blowing our minds. We're so excited about offering the therapy of people that are struggling with autoimmune disorders, which can't beat sinus infections, chronic Epstein-Barr infections, reoccurring herpes simplex 1, the cold sore virus, chickenpox and platelets, because some of the effects that we think that's happening is more oxygen to the organs, it's better dilation and microcirculation, it's helpful for circulation to the extremities, which is one of the problems with peripheral neuropathy. You know, if you're not getting a good blood supply and nutrient supply to the extremities, your feet can go numb and tingle. It feels like you're walking on dirt clods or wadded up socks, or your hands get tingly. Well, that's if it goes south, but what if your circulation goes north? This is one of the hypotheses that we think occurs with macular degeneration. We don't get good oxygen and nutrients to the eyes, and so what happens is if we improve that circulation, we get really, really good outcomes with some patients with some eye conditions. Now, the reason why I say some and some is because we haven't seen any detrimental effects. There are some people that haven't responded to therapy, but the vast majority, we get really good outcomes with it. So one expert said that there's membrane modifications that they think occurs with ultraviolet therapy with the blood cells, the red blood cells, the white blood cells. It seems to help certain types of platelet problems. The ultraviolet therapy also helps with direct bactericidal effect and changes the fungal trends of the immune system defense. So what does that mean? It means if your white blood cells are like guard dogs. If some bad guys get into your system, the dogs are supposed to bark and chase off the bad guys. So many times when you do a complete blood cell count with auto-differentiation with someone that isn't feeling the way they want or struggling with chronic immune system deficiency or an overregulation of their immune system, which we call autoimmune, what's happening is the guard dogs for your body aren't chasing off the bad guys. So the bad guys come in, and it's like the dogs are saying, hey, take the TV, take the jewels, take the cash, take the furniture, whatever. It's not doing anything. This is one of the ways that we help to get really nice exposure to things like, again, chronic deficiency problems, multiple sclerosis, rheumatoid arthritis. We've seen really good responses to when people's immune system overreact with allergies and autoimmune disorders. And what's fun about this is we have a whole packet of information. We've got the studies. We've got a nice print off. If you'll follow the link right in the comments, it'll take you there. You can get the report immediately. But some of the things that we think is happening, inactivations of toxins, increased oxygenation, activation of the chemical messengers in your body, allowing your organ systems to talk to each other, improved circulation, decreased platelet aggregation or stickiness of the blood cells. So this is the treatment that I did on myself just a couple days ago. These are the sublingual applicators. Obviously there's a magenta light and there's a red light. We played it right into the mouth like so. And then the machine's here. And so Caden, if you'll pick me up here on this slide. So this is exactly what's happening here. So we're about 9 minutes into the treatment. You see we have the red light application here, and then we have the blue, red, and green here. And Misty's so nice to be able to put it underneath the tongue, and we just have these fantastic things that are happening in the immune system response. That's what I did for myself. And when the treatment's complete, you hold on to the sublingual applicators, and we send those home with the patient. They're good for, I think, 5 treatments, and it's a completely painless way to help get all the benefits of ultraviolet therapy without hurting the patient, without having to do an IV or injections. So here's the link. It should be in the comments of Facebook, and it should be on our YouTube channel. And I wanted to share a really neat story with you about Brandon. Now, Brandon came to the office. I shouldn't say how old he is, but I'll tell you this. He's been sick half of his life. He came into the office, really cautious skeptic. This is us after we actually released him from care, and he came in and told the story earlier this week. And so let's show Brandon's story, and then we actually should be done with the treatment. So check this out. Hey everyone, it's Dr. West and Brandon. I'm going to tell Brandon's story, and I don't want to steal any of the information that he's going to talk about because it's really neat. And the story just told me, like, I still got goosebumps on it. But number one, Brandon, when you first came here, how did you feel?
I was pretty numb. I think my body was really overwhelmed. I think that it was so overwhelmed I didn't really know how sick I was. It's one of the things with Lyme is that, like, sometimes the sicker you get, the number you feel and the less you feel. And so I was sort of trapped in this, concrete body and just, didn't know how sick I was, but I knew I wanted to keep moving forward and trying progressing and getting better. So, and that led to a discussion we had a little bit earlier because you had been sick for a long time. How long have you been sick? I've had Lyme for about 20 years, actually. I got it about almost exactly 20 years ago. So it's been a long journey.
And so you came in here, and just like so many of our other patients that have complex and complicated healthcare conditions, you're like, I'm tired of paying for stuff if I'm not going to get better. So it wasn't belligerent, but definitely, cautious, skeptical. And I tell people the reason why you're like that is because you don't want to get your hopes up. They're thinking you're going to get better and then be let down again. But we started off with Lyme. You've been sick basically half your life. what were the treatments and then what happened?
So just to back up a little bit, I actually went to, I think it was 15 or 16 providers before Dr. West.
So I'm Dr. 17?
Yeah,
okay.
That's right. And I think around seven of them claimed to be Lyme literate. And so when I got here, I was pretty skeptical. But we got some IVs, like vitamin C IVs and a bunch of other glutathione and some other stuff, amino acids. And those have been super helpful. And I've been on the course of those. I came up about once a week for maybe for a couple months or something. And then I just kind of slowed down a little while, like every 2 weeks and then once a month. I've been doing that for about 2 years. You should come to Dr. West. It's a really great place here. They have a really great team. And one of the best parts is that you feel like people really care about you, and you don't feel like you're at a doctor's office. Like, guys aren't really into day spas, but it kind of feels like a day spa more. You know, it's kind of cool to come here and feel validated for the legitimacy of the disease, how serious it is, but also that there's a path to get better and there's a way out, there's hope. And that's what I love about the West Clinic.
Fun part about this is when I asked you, well, how do you feel compared to where you started to now? How do you feel?
Super awesome. Like I'm really stoked. Like, I have my life back, and a lot of it was erased or sort of neutralized because I was laying on a couch for most of my life, and so I've got it back. So I'm pretty excited about that.
So Brandon, what can you do now that you couldn't do when we first started working with you?
I can play with my kids more. That's probably the best thing. I can engage in their lives, take my boy on walks and stuff like that. Like, used to just, I was able to work a full-time job for the last 5 years. Before that, I wasn't able to. And now I can go to that job and have energy left over afterward to take my boy on a walk or do things like that. So it's really exciting.
Our plan for Brandon moving forward is we're going to help him so that he doesn't have to come to the office. So he's 90+% better. And I asked him, how do you want me to treat you? And he's like, just make sure I'm not skipping we're filling in all the holes. And then I'm like, hey, let's just get a reevaluation with you sometime next year. It's fun to say that because my goal was to empower Brandon so that he doesn't need us, and he's there. And so we're going to check him, and next year, 2021, it's going to be a great year. Brandon, it's been an honor to take care of you, and of course we're going to stay in contact. It's just not very often.
Yeah, but that's one thing I like about your practice is that the term I used earlier was health self-reliance, right? Like, what I love is that I feel like you're trying to empower me and help me gain knowledge about my condition and how I can improve it, but also to help me. I feel like your agenda is to actually get me better, not just keep me to come through run the cash register, right? So, I really appreciate that.
You're welcome, thanks. Brandon. It's awesome, Brandon. So we did infusions, we've done some neural therapy, we did some nutrition therapy. You took control of your life. You had to do some work over there, and when I say over there, you had to do some emotional work that I'm really proud of you for, because sometimes people don't like they see it and then they either resist or they run away. But you paid the price to do the physical treatments, you did the emotional freedom work, you put some relationships and parameters. I mean, it's just an all-around awesome thing. When you were telling me earlier, I just wanted other people to hear this, because you're not your diagnosis. Like, you can totally beat this. Brandon, is it okay if I share this message with others?
Yeah, sure.
So Dr. West and Brandon at the West Clinic, his daily dose of vitamin H stands for Vitamin Hope, and we'll share this for other people. We'll see you guys on the next video. Okay, you guys, so Brandon's stories are things that happen routinely inside of the office. It's not just me saying it, and Misty's seen it for over a decade. I promised I wouldn't make her talk. We're almost done with the treatments. We've got about 2 minutes. Over here you can see on the machines it says in progress. And Misty, let's have you pull those out so we can just show people what the lights look like. And so we're almost done coming down that home stretch. You guys, we say this all the time in the videos and everything else, that you're not your diagnosis. You can beat your disease. If you'll click on the link, I always point the wrong direction. There's information available, everything we talked about in the studies, the purpose for using different lights. Shout out to my friend Tori Miller. Hi, Tori. She's been messaging me about the different types of light that you can use systemically We also have a red bed therapy, and then there's a light treatment that Tori taught us about that has the red therapy and the blue light therapy. You can use different pads across your system, and we've been using that for a couple years now, because if you can get light into the system, if you can improve energies, the reason why people get sick is because they get imbalanced and they run out of energy. And some people get an autoimmune disorder. Some people get chronic infection. Some people get autoimmune disorders. And if you can put their energies back in balance using biochemistry and biomechanics and hormone balance and energies and emotions, you can really make a big difference. A shout out to everybody at the West Clinic, Shelby, the world's greatest nurse practitioner, and Dr. Nelson, who's our silent healer. He doesn't talk as much as I do, but he's got amazing clinical skill set. And that team, with our mind-body healer, Kelly Watney, is helping us. We are having some of the best outcomes we've ever had, and it's all about energy. So we are just wrapping up. Caden, bring me over here with this, because you can see the treatments. We are complete here with one. There we go, complete treatments. Misty is done with the treatments. So Caden, bring us back here on the picture. Perfect. Here we are. So Thursday Night Live with Dr. West. This is in our podcast system. We've done over 25 podcasts this year that we're categorizing. We have all of them put together with the information, with the studies, with all of the things that we're doing to help people, the cutting edge therapies of taking people that are out of hope and out of time and out of options and giving them their hope back, helping them find what they've lost. It's a wonderful way to make a difference in the world. So if you want some information on the ultraviolet therapy, just click on the link over here and recognize that there are things out there that you may not heard about. Every Thursday night, 5 o'clock on Mountain Time on our Facebook, in our YouTube, and now it's in our podcast studio. This is Dr. West and Misty. I said she wouldn't have to talk with Misty, just wave for us. And we'll see you guys next Thursday, 5 o'clock. If you have a healthcare concern, please understand and know your options. And if you want information about the service we offer, please reach out. And one other plea. If you have a healthcare condition or a question about something, please comment about it so that we can pick it up inside the podcast. We love to talk about the questions people ask. One of them was last week was hepatic steatosis, also known as fatty liver disease. So Jeremy, we're going to come at you with that question. Also, we talked about what to do for teenage acne. Besides using the prescriptive medicine approach, we want to talk about how you can help the blood and how you can help people to not overreact to food allergies frequently associated with acne, both teenage acne and adult acne. I'm excited to present that information. So Dr. West and the West Clinic team signing out. We'll see you guys next Thursday.